Welcome and good evening to this Cambridge Community Conversation. Today is September 3rd, 2020, and it's 6 p.m. My name is Bill Jones. I'm the elected state's attorney here in Dorchester County, and I'd like to thank you for joining us tonight. Some of you are joining us live. Some of you are taking the time to watch the recording after the fact of the streaming. Tonight's conversation is with Dorchester Goes Purple. We are broadcasting tonight from WHCP Studios in historic downtown Cambridge. And again, I'd like to thank WHCP for having us tonight. Before I introduce the topic and our guests, I'd like to thank the sponsors of the Cambridge Community Conversation program. That would include WHCP Community Radio, Cambridge Association of Neighborhoods, Dorchester Banner, Dorchester Star, also known as APG Publishing, and the Dorchester Chamber of Commerce. The goal of these conversations is to present topics of interest to the community so that if you have a topic you'd like us to discuss, please let us know here at the station or any of the sponsors. Now, as I said, tonight we're going to be discussing Dorchester Goes Purple, and this will be the first of two such programs that we're going to have this month. In this first program, we'll be focused on why going purple is important and the impact that the opioid epidemic is having in Dorchester County. In the second session, we'll come back on the 30th of the month, and we're going to be exploring positive outcomes and providing more details on how you can engage beyond simply going purple. Now, those of you who are familiar with this program will recall that in the past we've had larger events. We've been out in the community. We've had kickoff events, live music, things like that. Well, because of the COVID-19 pandemic, we've had to change the way we do business just like everyone else has. And so the idea was to engage in one of these Cambridge community conversations where we could talk about this, maybe have some guests in who can maybe shed some light, perhaps even answer some questions that you have along the way. Now, tonight, I am joined by three guests that I am confident will provide a great deal of valuable information in the short hour we have together. As I told you, we are at WHCP Studios, where we're trying to be socially responsible as a result of the pandemic. With us tonight is Dorchester County Sheriff James Phillips. He's here in another studio. And also we have Angela Grove. She is the Health Education Program Manager for the Health Department. She's here in the studio as well. We as well have Bob Willey. Bob Willey will talk to you about the profound impact that addiction can have on a family. And he joins us from out of state, where he's joined us remotely. And we're very thankful that he's chosen to do so and allowed us to sort of get to know him and his family a little better tonight. And I look forward to speaking with him. Just a reminder, you're able to ask questions by using the chat or comment feature on either YouTube or Facebook. Whichever way you're watching tonight is fine. If we are unable to get to all the questions during the hour, then we'll take those questions, we'll try to get ours, and we'll follow up either at the next section or find some other way to answer those questions for you. Now, before introducing our guests, I'd like to answer a couple of standard questions that we get from time to time. And the first and the most obvious really is, what is Dorchester Goes Purple? Well, Talbot County really led the way on this in 2017 as the first county on the shore to go purple. There was a project there spearheaded by Lucy Hughes, who was then the president of the Tidewater Rotary Club, as well as Joe Gamble, who is a retired trooper but currently serves as Talbot County Sheriff and is a very strong presence in doing so. The project over there got broad engagement throughout Talbot County and was really an effort to bring attention and shed more light on the opioid epidemic and its impact on affected persons. The effort is based on a program created by the Heron Project, and it's best described by this excerpt from their website. And if you'll indulge me, I'll read it for you just so you have a chance to see where this comes from. And I'm quoting here. THP Project Purple is an initiative of the Heron Project, a nonprofit foundation established by former NBA basketball player Chris Heron that assists individuals and families struggling with addiction. The THP Project Purple initiative was launched to break the stigma of addiction, bring awareness to the dangers of substance abuse, and encourage positive decision-making to navigate life's challenges. And that's the end of the quote. Now, each group that takes on the effort of going purple defines their goals and programs a little differently. Dorchester's no different. Ultimately, the primary objective is to increase awareness. This is an issue that affects everyone or can affect everyone. And we have found that working with these issues, that increasing awareness is the first thing we can do to work with prevention and treatment and things like that. So the goal of the program in Dorchester is quite simple, but also very challenging at the same time. We want to increase the awareness across all facets of Dorchester County's population. That could be from elementary school agents students, age students, all the way through retirees set to enjoy their golden years. This is important because, as I said, this can affect and does impact everyone and anyone. This problem knows no age, race, geographical, social, education level, or financial status boundaries. There really are no boundaries when it comes to who can be impacted by this epidemic. Everyone's at risk for being affected, and either by struggling with addiction, someone could be affected by this, or they perhaps are the loved one or family member or a close friend of someone who's struggling with these issues, or perhaps even employers. We see a lot of employers that are working really hard to help their employees make sure they have what they need. And so there really is no limit to who is in fact impacted by this. Now, one of the other questions we get from time to time is, why would you take money away from treatment programs for Purple Lakes? Because as we all know, purple is sort of the thing here. We've got purple lakes every place. And we try to put them where we can to really make sure that during this month, there's a lot of purple to make sure we get this message out. Well, I'm here to tell you that no funds are being diverted to Dorchester Goes Purple from any treatment or other programs that combat addiction. The GP program is funded by donations coming from the community and local businesses. All funds raised are going directly to the effort to increase awareness in Dorchester County. Now, the spend on this is pretty minimal, and all labor to execute the program has been donated. So any money that comes in goes directly into the program, and we don't really see any resources, assets, diverted from treatment programs or things like that into this program. This program takes care of itself. One of the goals of the program is to make Dorchester County citizens aware of all the work that has already been done in the county, and to help those in need find the resources to assist with whatever they may need in going through these issues and these battles with addiction. Again, whether it's them personally, a friend, coworker, loved one. One of the great examples of the fundraising that we have here are the Purple Mums that are available at Mowbray's Garden Center. Brittany and her team donate all the proceeds from the sale of Purple Mums in Dorchester to the program. And to help get the message out to the community, they're willing to do that. Last year, that was over $2,000. That's a great way to decorate your yard, and it's a great way to contribute to the effort at the same time. So the first person I wanted to talk to is Sheriff Jim Phillips. The Sheriff joins us tonight, and I'm very thankful for Sheriff to do that. I don't want to embarrass him, but one of the things that people don't often know is the Sheriff and I go back quite a ways. We worked together. I worked for him a long time ago, and I'm happy to say that decades later, I still have the privilege of serving with the Sheriff. Sheriff, good evening.
Good evening, Bill. How are you this evening?
Well, sir, how are you?
Just fine.
Good. Well, I appreciate you joining us tonight. Could you take a couple of minutes just to sort of introduce yourself, who you are, what you do, and your relationship with Dorchester Goes Purple?
Sure. As Bill told you, I'm Jim Phillips. I'm your elected sheriff. I have been since 2002. I actually started back at the sheriff's office in 1977 as a dispatcher. And I was fortunate enough over the years to take advantage of training and other opportunities that came my way, and slowly worked my way up through the ranks until in 2002, I successfully ran for sheriff. Bill used a term a while ago that he worked for me. He never worked for me. We've always worked together. We all work for the citizens and taxpayers of Dorchester County. It's just merely a process we go through. We all have to sit down and work together and make sure everybody's on the same page, and we pick out a goal and we go at it from different directions. And I think that's what makes us so successful. The Dorchester Goes Purple initiative, when we started it, we realized we had to get the word out. We had to get people talking about the addictions problem and the overdose problem in the county. And so we had to sit down. We met. We brought the Chamber of Commerce, came together, myself, the Cambridge Police, Hurlock Police, the volunteer fire companies, Bill Jones, the state's attorney, and numerous businesses. I know Whitten Insurance was a big stakeholder initially on it, and they're still involved with it. And we were able to develop programs and to go out in the community and put out presentations. I know I myself have gone to Block and Guggenheimer up in Hurlock and talked to all of their employees. I had several opportunities to go out to the Votech Center to talk to students out there. I know Bill's done some speaking engagements out at the Hyatt. the more we can get people talking about this, the more attention we can bring to this, the better chance we've got of trying to get it under control and get a handle on it. I'm very, very fortunate to be associated with the group, Dorchester Goes Purple, simply because everybody's united and we're all trying to work forward to get a handle on it. And there's no territorial boundaries. Nobody's battling for turf and saying, well, this is mine and that's yours and I'll take care of this. It doesn't happen here. We don't work like that.
Well, I appreciate that, Sheriff. Could you, one of the questions we get frequently as part of this program is, drug use and overdoses have been problems for years. Why is this getting so much attention now? How come it wasn't getting as much attention years ago when we had other challenges like cocaine and marijuana? What's different now that's caused us to have to be a little bolder in our approach?
Well, as you said, cocaine and marijuana have historically been a problem here in the county. We didn't really start seeing heroin around here. We saw a few cases as long as 10 years ago, but about 2016, 2017 is when it really rare to see it here. And the major difference was we started losing people because of the overdoses. It was due to two things: the purity of the heroin, and they weren't used to it, or the mixture of fentanyl within the heroin. And when we started having people die because of the addictions, and we were dealing with those out on the street, we realized then that we needed to get another gear, if you will, to pick our efforts up, to come together and try to be more successful in what we were doing, not only on the enforcement front, which we've made numerous changes on that, but also working with the health department and some of our other partners in that field to address not only the addictions, but also the mental health issues associated with addiction. So it's been a complete community type approach to get a handle on this problem out here. And like I said, we're very fortunate that we have a dedicated group of people that are working together in that fashion.
Now, when we talk about, Sheriff, the marijuana and the cocaine, certainly marijuana use has been around for a long time. Cocaine, I was a brand new police officer in 1988. As a matter of fact, we're really seeing crack cocaine come on strong. Is there something different about the heroin in terms of its impact? Because I think people question a lot of times, well, couldn't you have all the same number of cocaine overdoses? Or is this problem on a different scale? Is the heroin impacting people differently in larger numbers? Or is it basically like cocaine and do the same things? I'm not sure that everyone necessarily understands the sort of relationship between those two.
Well, I think when the crack cocaine hit here, I mean, we felt like we were under attack because we weren't prepared for what it did to our society. And we played catch up for a couple of years until we were able to get some really good investigations going and get some of the bigger dealers under arrest and try to break up some of it. It's still here. It's probably always going to be here. But again, the heroin, with cocaine, we very, very rarely ever had anybody die from using cocaine. With the heroin, the appearance of the heroin, the purity of the heroin, where it's originating from, the people just aren't used to it, and then we turn around, we add the fentanyl to it, and it just gives it all a much more sense of urgency to try to get a handle on it, to defeat it. Unfortunately, a lot of people become addicted to pain medications simply not because they're addicts, not because they want to abuse it, but it's because they've had an accident and they end up getting prescribed pain medications. They develop addictions to them, and then when they can't get the pain medications anymore, they come out and they start looking for an alternative to what they were having prescribed to them. And a lot of people turn to the heroin in order to get that same high or that same feeling, and that just compounds the problem that much more.
Yeah, I would agree with you there. I can tell you that we're in the local courts oftentimes with persons who have addictions issues. The judges will ask, how did you get started? Our judges are very good about trying to understand what people need. How did they get where they got? And what interventions do they need from the court or treatment professionals to do that? And that's the same story we hear very often. Someone went to the dentist and had a tooth pulled, or they had a car accident. And before you know it, they quickly, unfortunately, become addicted to those painkillers. And when the prescriptions for those run out, then they're turning to illegal sources for those pills on the street or things like that. And eventually that dries up because it's expensive. Then the people are unfortunately turning to heroin, which is a low-cost alternative all too many times. So my experience has been the same as yours for sure. In terms of trying to get a handle on this, Could you talk about the steps that your department specifically and then law enforcement generally within this county are undertaking to try to battle this situation?
Sure. About 4 years ago, as the heroin was becoming more prevalent here, we decided to seek a designation as a HIDA. It's a federal HIDA program, high intensity drug trafficking area. Wycomico County had already received that designation, Worcester County. So we sought that designation out and were successful in obtaining it. And what that does is it brings the federal authorities in here in person. They actually have investigators here on the ground that work with us. They bring funding, which is always in short supply with them, and they bring a level of ability with them, whereas used to be we were bound either by county lines or state lines. Well, with our federal partners here, we're able to cross those lines. We know no boundaries. We can, if we get a lead and we can follow it up, we can go to Philadelphia, we can go to New York, we can go to Richmond, we can go wherever the lead takes us to try to get a handle on the organization, to trace it to its origin, and to take out as much of that organization as we can. So that's one of the things that we've done, and we all do that together. Cambridge is part of it, Hurlock's part of it, the Maryland State Police are part of it, Bill Jones's office is part of it, and our partners with Homeland Security Investigations are a big part of it. We've had a lot of success with that. We continue to be successful with that. It's just a win-win when it comes to sharing the information across the boundary lines. Again, we no longer have those walls at the borders. We can follow it wherever it takes us.
So, and you mentioned the HIDA designation. How does that work with, as I understand it, we have a Dorchester County Narcotics Task Force. And so could you talk a little bit about sort of the staffing there? And obviously, we don't want to get into sensitive materials, investigative techniques, things like that. Could you describe basically what that entity is and how that relates to the HIDA designation as well?
Well, the Dorchester County Narcotics Task Force was started in 1990 under previous State's Attorney Mike Maloney and Sheriff McKelvey. Before that, we were operating under a regional task force that operated out of Wycomico County. And as the drug problem evolved, the crack cocaine came along. We saw a need that we had to have our own task forces, as did the rest of the counties. Our task force here is made up of a member from the State's Attorney's Office, Cambridge Police, Hurlock Police, Sheriff's Office, and Maryland State Police. And what they're charged with is, as the patrol guys are out here doing their jobs, making traffic stops or whatever, if they come into information, drug information, where they think there's some nexus to a case, then that information is forwarded on to the Narcotics Task Force. And those guys are strictly there to follow that information up, to analyze the information as it comes to them, and to be able to start building a case from the ground up. The addition, as I told you, the addition of the HIDA component to it used to be we were limited, and now we could ask for in specific instances and receive federal help. But with the addition of the HIDA component here, we no longer have to do that. Everybody is right there. The investigators from Homeland Security are right there with our guys as they're out on the streets of Dorchester County doing these investigations. So we no longer have to ask for that. They're involved from day one, and we just take it and run with it and go as far as we can.
Now, Sheriff, you have a tough job. I don't think anybody would disagree with that. And I think that all of us probably who are trying to work on this would probably feel the same way. Rewarding, but tough at times. Could you share, or would you be willing to share what you believe to be is the toughest part of your job as it relates to this epidemic?
I think the two things that we've had to struggle with most during this epidemic is, the deputies and all law enforcement, obviously we're deemed as essential personnel. We have to keep them out there doing their job, but at the same time, we're trying to keep them safe from contracting the COVID disease. So you have to do we pull back and kind of let things go, or do we maintain the contact and keep enforcing the law and looking out for ourselves? We have to keep that in mind. So you have to develop new policies and procedures for that. But I think the added component, the added thing that's come out of this that I think is stressing us more than anything, we are dealing with probably 3 or 4 times the mental health issues with people now than we were prior to the COVID-19. The incidences of people wanting to harm themselves or commit suicide or just reaching out and saying, I need help, have tripled or quadrupled since this started.
Let me ask you this: how stressful is it, or how difficult is it, dealing with families that have been impacted by the opioid epidemic? And while talking about that, could you maybe talk about some success stories you've seen?
Well, it's difficult, certainly to deal with them. Um, some of the things that we've seen or that we've done. I know we had Bob on here tonight to share his story from his family. But I tell you, I had an incident, had a family that my children were raised around. They lived next door to us many years ago, and their son grew up with my son. They played baseball together all the way up into high school. Many a times he was at our house for dinner. And about 4 years ago, he died of an overdose. And you can't say that because somebody's an addict or a bad person. He had been involved in a car accident. He had developed an addiction to pain medication, and when he got off the pain medication, when the prescriptions ran out, he turned to heroin. People were trying to work with him, but he kept chasing the ghost, and the ghost got him before it was over with. And I'll tell you, that hit me hard when we had that call that day, and that's kind of the reason that I pushed so hard for us to start supplying Narcan and to get the Narcan out, is because of that incident and a couple other incidents. You have to look back and realize that every one of these victims out here, irregardless of what they're involved in, irregardless of what their background is, every one of these people out here is somebody's son, somebody's daughter, somebody's brother, sister, mother, father. They're humans just like the rest of us. They're struggling. The demons got hold of them. And the way I look at it is, if the good Lord, if they overdose and the good Lord wants to take them, he's going to take them. If we can get there and give them Narcan and it brings them back, then guess what? It wasn't his time that night, and it was meant to be that he's going to come back. And who knows, that may be the turning point in their life where they go and they seek treatment and they turn their life around and they become a valuable piece of our society. So you never know how it's going to work out.
Now, you mentioned the Narcan, also known as naloxone. Could you tell our viewers, for those who are not familiar with that, generally what it is and why it's carried by your deputies?
It's a nasal. What we use is a nasal spray. It comes in a little canister. You carry it with you, and if we get a call for an unconscious person, and if we don't know why they're unconscious, we'll hit them with the Narcan. I use that term probably loosely. We spray the Narcan. We administer the Narcan, as do our medics, and a lot of common citizens out here are carrying it now, and it does away with the effects of the opioids, if that's what the problem is. It brings them around almost instantaneously. In a lot of instances, they'll come back out of it, and they're able to then be treated at the hospital if so needed, and to go on their way. But it's something that's being provided through our health department. I know they have dates and places where you can go and get Narcan free. It's free of charge. They just ask that you take a few minutes to go through a brief training session to make sure that if you apply it and when you apply it, you're doing it correctly.
Do you have any sense as to how often roughly your deputies deploy that, maybe in the course of a week or a month or a year, anything like that, to give our viewers some sense of the scope of that?
Well, I don't have specific numbers for my deputies, but I can tell you, according to ESIC, the Eastern Shore Informational Center, in 2019, from January 1st to August the 30th, police departments on the Eastern Shore of Maryland in the 8 counties applied Narcan 256 times. Through the same time period this year, we've applied Narcan 312 times. Oh. So it's out there. It's a life-saving application. It's free. It's simple to use, and it's something that I'd like to see everybody carrying. A lot of people, ride around. They'll have a first aid kit in their pickup or their car in case they run up on a car accident or something like that. I would request them to add Narcan to that first aid kit. They might save somebody's life that they know sometime.
Well, Sheriff, I appreciate your forward thinking in that area. And I really thank you for your comments tonight, your willingness to answer some questions. I'm going to ask you to stay because there's a chance that we may have to come back later, maybe ask some follow-up questions, if that's okay.
Absolutely. And I'd like to thank WHCP for hosting us tonight. It's community radio in Cambridge, Maryland. And I see by a great big placard on the wall here, it's a great place to be.
That it is. Thank you, Sheriff.
Yeah.
Next, I'd like to introduce Angela Grove. Angela works for the local health department. And Angela, I would ask you to take a couple of minutes to sort of talk about yourself, what you do, how you got to where you got, if you don't mind, and then also maybe talk about why Dorchester Goes Purple is important for the residents of this county.
Sure, yeah. So my name is Angela Grove. I'm the program manager of health education at the Dorchester County Health Department. So I oversee programs that help individuals and communities improve their health through outreach, education, influencing attitudes and behaviors, really on a broad community level. I've been working in substance abuse prevention for 10 years. And I think Dorchester Goes Purple is a great example of a community level effort to address a health problem, in this case, substance abuse and misuse. And I think there's many reasons why it's important. And personally, for me, one of the things that I've really appreciated about Dorchester Goes Purple is, like the sheriff was saying, seeing all sectors of the community and members come together to share this unified goal. I think with any health issue, it's much more complicated than what you just see on the surface. It's much deeper than just substance abuse. And so it's really not going to be this one size fits all solution. I think we really have to come together, build relationships, think outside of the box, and recognize that everyone, so every agency, organization, person has an impactful role and responsibility. And, even just taking the Dorchester Chamber of Commerce, for example, I think Dorchester County is really fortunate to have a chamber that recognizes the importance of health of the community and its impact on business.
I'm going to put you on the spot for a moment. You said something about issues deeper than the substance abuse issues, the addiction issues, the things that are sort of underneath. Could you talk for a minute about what you mean by that? Because I think that that's a really important concept. So many times people see this as a one-dimensional addictions issue, and they just see the addictions issue without understanding that if that's sort of at the top of the pyramid, there are all these other issues that are impacting someone's life.
Sure. And yeah, like we said, substance abuse affects all communities. And I think especially now, there's so many stressors. I know the sheriff touched on mental health issues. It goes much deeper than just misusing prescription opioids or using heroin because you're addicted to opioids. I think, we have to be mindful that we're talking about real people and there's real issues. If it's financial stressors, if it's a lack of understanding, if it's stigma related, and if people have issues and they're, feeling challenged to seek treatment resources, I think it just goes much deeper than what you see on the surface.
Right. So when we talk about, obviously the sheriff hit upon the COVID pandemic. Could you talk about how the COVID pandemic has impacted addictions issues, particularly here in Dorchester County?
Yeah, I think there's no doubt that COVID-19 has impacted us, the pandemic, locally. If you're looking at opioid overdoses and fatal overdoses, they've dramatically increased. And that's not just the case in Dorchester County. I mean, that's statewide as well. So I know in January, there were 2 overdoses. February, there were 2. There were 8 in March. And I think the stay-at-home order went into effect March 30th, so towards the end of March. And then when you look at April, it jumped to 11 overdoses, 18 in May, and then 15 in June. So that's 56 total overdoses between January to June, 12 of which were fatal. And so we surpassed the total number of deaths we had last year, so calendar year 2019, in half the amount of time, January to June in 2020.
What do you think's behind that? Do you have any working theories as to what some of the contributing factors are? What is it about this pandemic that have caused people then to suffer in this other way?
So I don't know for certain. I think it's reasonable to say that the impacts of COVID-19 have contributed to the increase. Programs had to shut down and find new ways to reach people. There's limitations to virtual services, although it's great to be more accessible like we are tonight, probably in people's living room. I think, there is kind of losing this personal touch by not seeing people in person. And so, when I talk about COVID-19 safety measures, I try to be careful in talking about physical distancing versus social distancing, because we don't want to lose those social connections with our friends, our family, treatment and recovery programs. Even as programs have reopened, it's been really difficult to reconnect with people and get them back into these programs. And I just think these are very stressful times, and unknowns are difficult and scary.
Well, it's difficult. I mean, just because something is open doesn't mean people are comfortable leaving their homes. You can go to restaurants, but some people aren't quite comfortable enough to do that yet. So I would imagine that the same impact is seen in our treatment areas as well. Certainly, you can imagine a therapeutic session, where people are trying to wear face coverings. Everything has been impacted. And so certainly I would think that what you're saying there certainly makes sense. You mentioned a few statistics. Do you have any sense as to where we are? Obviously, from March through now, things have picked up. Do you have any sense of where we are on a year-to-year basis, things having picked up? Are there any other statistics that you think would be helpful or relevant?
Oh, yeah, I'd love to share some statistics. But before we do,
okay.
I do want to say, like I said before, we have to remember we're talking about real people. And I feel like it's become a little bit cliche to say, you don't think it'll happen to you until it does. And I think substance abuse really impacts most people. I mean, we're all affected by it some point in our lives, and there's real consequences to that. So I don't want people to just tune out for the data portion. I really want to encourage people to use the data as talking points or food for thought. So you can grab a notepad and a pen and take some notes. I'll give you a second. And we'll also be promoting the daily messages on Dorchester Goes Purple's Facebook page and WHCP on the radio. There's going to be daily messages, so use those as daily conversation points if it's with your child, your grandchild, your friend, coworker, anyone that you care about. But to start it off, this is based off of the 2018-19 YRBS Youth Risk Behavior Survey. 14.7% of Dorchester County high school students and 6.7% of middle school students have misused prescription pain medicine.
Wow.
And so when we talk about misuse, it can be using a prescription drug not prescribed to you or differently than prescribed, such as a higher dose or more often. And, I think the sheriff had touched on this. I don't know if people realize that you can become dependent on prescription pain medicine at prescribed or recommended doses. So even if, you take it as your doctor prescribed, there's still risk associated with that.
Oh, you're absolutely right. I mean, that's one of the things that we see as we talk about it. People taking their lawfully prescribed medication. It's not that they were abusing it. It's just that it didn't take very long for that addiction to kick in. And by the time the addiction had kicked in, they were sort of in the throes of trying to figure out how to get out of it. So I agree. The other cases we see sometimes, the ones I refer to as the medicine cabinet cases, maybe mom or dad had a prescription for oxycodone or something like that, and they didn't need to finish it. So rather than dispose of it, they just sort of put it in their medicine cabinet, which unfortunately is inaccessible to teenagers or kids or whatever. Do you hear about that happening any frequency?
I do. And it's like you knew what my next data point was going to be.
I'm sorry.
No, that's perfect. So I did want to highlight the majority, and this is a national survey, but the majority, 51.3% of people misusing opioids get them from friends or family. And that could be knowingly or unknowingly taking it from, medicine cabinet, like you said, from someone's home. But more often than not, it's friends or family providing it to a loved one. Yeah.
So what's the best way to avoid that in terms of the unused prescription medications?
Yeah, so that's getting into the whole prevention piece. And so we are big on promoting proper storage and disposal. So if you have medications, we really encourage you to lock those up and keep them someplace that aren't accessible to children or visitors in your home. And then we also have what we call permanent medication drop boxes throughout the county, where you can take your unused, unwanted, expired medications, drop them off at any law enforcement agency in Dorchester County for safe disposal, anonymously, no questions asked. And then if you can't get to a lockbox, there are at-home disposal kits like doTERRA bags,
okay,
that you can safely throw them in the trash.
Before I ask you my next question, I want to make sure that I know you're a data person, and I respect that. I wish I was a little more like that sometimes. Are there any other data points you wanted to make sure that you got out there? Because I know there's a lot of data out there on that.
Yeah, I did want to highlight 4 out of 5 who use heroin first misuse prescription opioids. I know we kind of already touched on that, but to give you a hard number. And so past misuse of prescription opioids is the strongest risk factor for starting heroin use. And back to some local student data, we had talked about students misusing prescription pain medicine. We do have some data for students who have tried heroin as well. So 11.6% of Dorchester County high school students have tried heroin, and 9% have injected an illegal drug. And that's, again, based off of the 2018-19 YRBS data.
Wow. I appreciate you sharing that information. It's sort of, I don't know, it's sobering to hear some of those numbers, really. So what's a good source of information for people who want to learn more about prevention, treatment, things like this?
So I really encourage everyone to go to iwishiKnewMidshore.org. It's got a wealth of information for Midshore residents. It was really birthed out of the Midshore Opioid Misuse Prevention Program. We had conducted a needs assessment several years ago to identify the problem and ways to have some positive outcomes. And so we found these themes that people wish they knew. And so the website talks about how to access treatment and what that process looks like. There's a Get Help tab. There's also an interactive treatment navigator tool to help you get connected to treatment and recovery resources. It talks about the importance of proper storage and disposal, like we said earlier, so I won't go into great detail about that. There's tips for talking with your healthcare provider. And so, I think it's important for people to know that your healthcare provider works for you. And so you can ask questions about the risks of opioids if they're prescribing that to you or your child, and ask about alternatives to treatment. There might be other options that might be appropriate for you. And so our website has a parent toolbox and family support resources. And then I see on the screen, I did want to plug, if you are in crisis or need help when the health department isn't open, please call the Eastern Shore Crisis Response Hotline at 888-407-8018. That is a 24-hour line. And then the state has a hotline as well. You can call or text 211. And then always call 911 if it is a situation where someone's overdosing.
You make a great point about those painkillers. And one of the things that I tell people all the time is just because it's been prescribed for you doesn't mean you have to take it. I know that I had a procedure a few years ago and I had probably a week's worth, but after a day and a half, I was able to transition to Motrin and Tylenol. Probably wasn't as comfortable, but I was really worried about the addictive forces behind some of the medications I've been provided. So I tell people sometimes really think about whether or not you need it. So Angela, I'd like to thank you for your time and the wealth of information that you've shared. I would ask you to stick around because we may have some questions for you when we circle back later. Next, I'd like to introduce you to Bob Willey. Bob, are you there? And Bob joins us from out of state. Hi, how are you?
I'm doing fine, Bill. How are you?
Good. I think you're out of state on business, but you nonetheless agreed to join us tonight, as I understand it.
Yes, I am.
Well, I'd really like to thank you for doing that. You have a very important, special, powerful story that you've agreed to share with us tonight. I've known you for a number of years. I've known your family, and I can tell you that all of us are very thankful for your willingness to come and meet with us tonight. So I'm going to start off. Could you tell us just a little bit about your background, your family structure, and ultimately some things that perhaps you experience?
Well, my wife, Laurie, and myself, we have 2 daughters, Rachel, and of course, Roxanne, who I'll speak about here in a moment. I work for Hills Industrial, which a lot of people knows it as Hills Electric there in Linkwood. Been there 45 years, right out of high school.
Wow.
Just a local Dorchester County. And just middle class, we get along, get through, and keep on going every day.
You're, as I said earlier, you're basically the American family.
Basically, yeah. Both girls went to Vienna. Both girls went to Cambridge, South Dorchester. Rachel went off to Frostburg, and Roxanne went to Chesapeake, and got their education and stayed home and worked.
And I think Lori worked for the Bank of the Eastern Shore for a number of years.
Yes, she did. She worked at the Bank of the Eastern Shore for 20 years
Wow.
before they had their issues.
Sure. No. So at a certain point in time, as I understand it, you came to be aware that Roxanne had some struggles. Is that a fair statement?
Yes, we did. Of course, Roxanne was 27 at the time. She was living on her by herself. We knew she slipped and fell down a flight of steps at her house, and of course went to the hospital. And like you and Sheriff Phillips were talking, they got the magic pills, the pills that took all the pain away. And when the pills stopped, the pain was still there. And like you said, they go out, and Roxanne went out and started using pills off the street. Excuse me. And of course, that led to another thing, and she couldn't afford the pills anymore. And of course, her dealer turned her on heroin. And she said, "Dad, yes, that first time I did heroin was a choice." She said, "But I couldn't get away from it from then on." She was my daughter, my perfect daughter, along with Rachel. But she would take anybody in. She took her friends into her house. She had one friend that had just had a baby, and she took them in, put them up. While the mother worked at night, Roxanne took care of the little boy during the evenings. Even when she was clean from coming back from rehab, she would take some people that were in rehab and help them along at her house. Was that a good thing? I don't know, but anyway, she she had her struggles. She fought the demons. She'd sit there and she'd tell you that she'd say, "Dad, from the time I wake up in the morning to the time I go to bed, I want that next high." It had grip of her, and I think deep down inside she knew that the drug was going to win out. Like I told people before, she enjoyed life. Anybody that knew her, and there's a lot of people in Dorchester County that knew Roxanne, knew that she enjoyed life. She enjoyed having a good time, but she enjoyed the drug just as much.
Would you be willing to share with us a little bit about her efforts to deal with that, to battle that in terms of treatment and recovery, things like that?
Yes. Well, the first time we found out about it, she was on a trip with some friends, and when she came back, she told us she needed some help, and not knowing it was heroin, thinking myself it might have been alcohol, and when she told us it was heroin, that that was a shock. So we got her treatment. The insurance companies in the states, insurance just does not help the addict, in my opinion, enough. She went away for 15 days. That's not enough time to clean you out, especially on heroin. She came back. She stayed clean for a few months and then was right back at it again. So she ended up going to rehab twice. The morning she passed away, and Sheriff Phillips men found her, deputies found her. She was supposed to be leaving that morning to go to her third rehab.
And how did you get notice of that? Who notified you?
Sheriff Phillips and Deputy Hagedorn. They came to my wife to the house and told Laurie. Of course, Laurie does child daycare, so that kind of things went kind of crazy that day. I was in Delaware on business and got the call and came home, and we had started the night before looking for her. We spent that night was like a lot of other nights that I had spent going out looking for her. But
what was
that
that like?
night I didn't find her.
What was that like for you, sort of through, I don't know, could you talk about what sort of time period that you all lived with this, and sort of how many times or what your life was like every day trying to figure this out, where she was, what she was doing?
Well, you were always in constant worry of where she was. She had got herself in trouble and she got arrested in Delaware, and of course she was on a curfew. She was supposed to be home at 10 o'clock. If she didn't show up at 10 o'clock, well, first thing you do, we started calling. A lot of times she wouldn't answer her phone, so then we proceed to go out and look for her. And there were times you spend most of the evening looking for her. Most of the time, there were certain spots you could find them, and I'd find her and bring her on home, and that would happen, once or twice, maybe 3 times a month. So
I'm sure that wasn't easy for you.
no, and you get to see the real Dorchester County after dark. Um, I don't mean that in a bad way, but there's the addicts come out in the evenings. These people don't want to have this problem. It's a sickness. It's a disease once they get it, and I know how hard Roxanne fought against it, and it's hard to describe sometimes to people that has never been around it, but it really works on not only the addict but also the family. It tears at the family's faith. It tears at the family's finances. So it doesn't only affect the addict; it affects everybody in the family. We kept it to ourselves. We kind of kept it in house because of the stigma that heroin addict has as being a junkie. Roxanne wasn't a junkie. She was a good person that made some bad choices.
And I think that you sharing that with us tonight, sharing your story, sort of drives that point home. Is there anything, one, from your experience that you would want people to know going forward?
Especially with the younger children, the school age children, be observant with them. Look at actions. One of them that I learned from the experience is the nods. When they do heroin, they'll nod out. They'll just sit there and go right out. The long sleeves in the summertime. Roxanne was very outgoing, and then next thing you know, she kept herself in a room. She didn't want to have nothing to do with anybody. So, kind of look for those kind of things.
Right. Is there anything you think Roxanne would want people to know going forward if she were here today?
That she wasn't a bad person. That it can happen to anybody. Anybody can get in that situation, and if she was here today, she would be out front with the rest of us fighting this problem. But there again, unfortunately, she didn't make it.
Bob, I really want to first tell you that I'm sorry for your loss, as we all are, and thank you for having the courage and the strength to come out here and tell this story, because I think that it certainly has had on me, and I know others, a profound impact. And as I believe countless others will be helped by your experience and your willingness to share that. I'm also going to
Thanks for having us.
I'm going to ask you to stick around for a minute because we may come back depending on questions and how time goes. Sheriff, I'd like to ask you something. Bob talked about this happening the day Roxanne was supposed to leave for treatment. Have you had any information or received any information or heard anything or seen anything about sort of dangerous times for people in the throes of addiction, for relatives when they go to treatment, things like that?
Yes, that unfortunately, that's not an isolated incident. We've heard of numerous things or times when people were scheduled to leave the next day for treatment, and they would go out to see their friends for one last time, because if they're going to be successful when they go through treatment, they have to change people, places, and things. And they know that. And they go out that one last night to say goodbye to the friends, to just tell them I'm going to be gone for a while or whatever. And they end up using one last time. And unfortunately, as in Roxanne's case, they don't make it. It's the last time for everything. So yes, that's not unusual.
As part of that, Sheriff, I've also been told and actually seen some cases where another dangerous time for people is when they first come out of treatment. And for whatever reason it didn't take, they slip pretty quickly and they start using again. And as it's been explained to me, while they were in treatment, not using, while they were clean, their tolerance for these substances became diminished, so that after they've been clean for a certain period of time, they go out and for whatever reason decide to use. But what was a safe amount or level for them before they went in treatment is suddenly not safe for them. And a lot of times the overdoses come as a result of that.
Yes, we've seen that numerous times with people that have served jail time in our detention center. Within a short period of time of being released from jail, they'd go out and they'd shoot up or snort up or whatever. And because of that lower tolerance, they'd overdose. We've seen that several times too.
Right. Now, when we talk about overdoses, one of the things that I wanted to make sure we hit upon tonight was the existence of Maryland's Good Samaritan law. I think most people have probably heard a little something about it, some more than others. And I just want to make sure that everyone is understanding of this one fact. If you get in trouble, or if someone gets in trouble around you, if you're with someone who is suffering an overdose emergency, a medical emergency, the legislature passed a law that basically says that any evidence that comes from that cannot be used against someone. So, for example, if someone is out there and two people are using and one overdoses, if the first person calls 911 and seeks help for that person, then generally speaking, no criminal charges are going to come out of that episode. The evidence that we find at the scene cannot be used against them. And that sort of translates into all types of criminal proceedings, to include violations of probation, parole hearings, things like that, even violations of pretrial release. And the reason for that is that we don't want people to be afraid to call and ask for help, because in the end, what all of this is about is saving lives, whether it's prevention, treatment, what have you. And as part of that, there's that emergency medical response. And so I can tell you that the legal system here in Dorchester County has interpreted that pretty broadly. And that's really because the courts and the prosecutors are trying to give the full effect of the law that it was supposed to have, and that is to save lives. Sometimes, we don't always agree with just how broadly interpreted it is, but that's okay, because in the end, we want that person to call for help for yourself, call for help for someone else. There are certain exceptions to this, like certain felonies, for example, aren't included. But I'm here to tell you that for the users, the people who are using these substances, who find themselves in trouble, I'm here to tell you, we want you to make that call. Because if you don't make that call, the sheriff's deputies maybe don't get there to administer Narcan. The EMS providers don't get there to do what they have to do, whether that's providing Narcan or providing advanced life support, transport to the hospital, things like that. So I would implore everyone to understand that we want you to make that call. And when you do so, we are not looking to punish you. We're looking to make sure we solve that medical emergency, that we save somebody's life. And then thereafter, we can deal with that. Maybe that's the moment where we're able to get somebody into treatment. And as part of that, I'd like to maybe bounce to Angela for a second. What happens when somebody suffers that medical emergency, that overdose, they go to the hospital? Are the resources in place for that person to, once they really hit that low, is there something for them to try to say, this is the time we can offer support to that person?
Sure. Yeah, we do have programming, including on-call peer support. So when there is an overdose, we have peers, which are people with lived experience who are authorized to go into the hospital system or respond to an overdose scene, to really connect with individuals and even family members to help get them connected to treatment and recovery programs.
Okay, great. Thank you. Sheriff, I wanted to circle back to you on fentanyl. You mentioned fentanyl earlier in the program. And first, I'd ask you to address generally what its impact has been in terms of the deadly nature, and where we are finding it, how we're finding it, things like that?
As far as its deadly nature, it's catastrophic. It's been explained to me that a crystal of fentanyl the size of a grain of salt is all that's needed to be a fatal overdose to somebody that ingests it. Now, with that being said, I think we'll all agree that probably 99% of these guys that we've got that are cutting the heroin or cutting the cocaine, which we've also found fentanyl in, are not pharmacists. They're not scientists. They're not chemists. They're just street level drug dealers, if you will. And I'm pretty sure that no two doses are the same. Most of the fentanyl that we've come into contact here, we can trace its origin back to China. China, the black market in China has flooded our United States market and the world market with illegal fentanyl. It's not pharmaceutical grade fentanyl. It's a black market fentanyl, and it's very, very dangerous.
I was at some training sometime earlier. I was also told that some of the heroin that was coming across the southern border was being sort of laced with fentanyl even before it gets into this country, such that the local deal, by the time it gets to the distributor here at the local level, they have no idea what's in there.
Yep, that's exactly right. They're also, like I said, they're also lacing the cocaine with fentanyl now. It's just a matter of being able to take a kilo and making it 2 kilos by cutting it with fentanyl. It's more money in their pocket. They don't care how many people they hurt or kill out here. They're just looking to put money in their pocket.
So is it fair to say with that, then a lot of times people, it's not just that they got too much fentanyl. They went to buy cocaine or a small packet of heroin and had no idea that someone had previously laced it with that fentanyl.
Oh, absolutely. Absolutely. I think that's a 100% true statement. It's such a concern to us that we've changed the way when we seize drugs, we've changed the way we handle it. We've changed the way we seize it and package it. We're even carrying Narcan kits for our canines now in case the dog, if they're out there and they're sniffing and they inhale the fentanyl, we've got Narcan kits for the dogs also. It's created a very dangerous environment for the people that are doing the investigations.
Well, I'd like to thank you and your people for doing the good work there. And as I understand it, we've had exposures in this county before where law enforcement personnel have suddenly sort of passed out and had to be transported to the hospital because it was unknown even as to what they'd been exposed at that point in time.
Yes, we've had several.
Okay.
Hey, Bill.
Well, yes, sir.
To Jim's point, Roxanne's death was actually, her cause of death was cocaine, fentanyl intoxication. So what she bought that night was cocaine that was laced with fentanyl.
Yep.
So that was the actual death certificate read,
right.
Cocaine, fentanyl intoxication.
Yep.
And not even heroin. And
not even heroin, no. And not to get back on her point, but back on Roxanne, but she had told me that she was afraid of heroin after her last rehab. She was afraid of the heroin because it was being cut with fentanyl, and right. That's when she started doing the cocaine, and that's.
We've even seen some cases here where I'm told where the supply of cocaine has diminished. And people are trying heroin because they can't even get their first drug of choice sometimes, and we're getting fatal overdoses from that. So it's a combination of people doing things that they don't normally do or trying some things they don't normally do, and it certainly creates a very dangerous situation for those who are involved.
Yep.
So with that, I'd like to thank the sheriff and Angela and Bob for their time tonight, their ongoing efforts to battle this on behalf of the community. I'd also like to thank an unsung hero, Bill Christopher, who's in the other room, executive director from the Chamber of Commerce. He's the sort of unsung hero of all this. And I can tell you that this program does not work and it does not happen without Bill Christopher. And I would like everyone, if they have a chance, to thank him because he and the Chamber have really done the yeoman's work in giving us this program and the assistance that we need. Tonight's program was to provide information about DGP. We shared information that we hope helps you understand the challenges and the horrible consequences. When we come back on the 30th, we're going to be talking about some more things and maybe some information that comes back. If there are things you'd like us to discuss, some feedback, other topics, questions you have, we'll be more than happy to answer them. So again, I'd like to thank our sponsors, and the next conversation will be September 9th with local law enforcement representatives, and you can find it right here on WHCP. Thank you.